On this Thursday night, pandemic projections for Canada. The possible outcomes from best case to worst case.
It depends on what each of us does right now.
Staggering job losses, Canada's worst monthly numbers ever. What's happening inside long-term care homes? Serious concerns about what's fueling the spread.
It is absolutely a perfect storm headed directly for disaster.
As residents keep dying in care homes across the country. Managing our mental health in melancholy times.
They have no idea what the long-term plan is, even what the short-term plan is.
Some ideas on how to pierce the gloom.
Global National with Donna Friesen.
Good evening and thanks for joining us. It's only been 100 days since the first reports of a deadly new virus emerged in China, and look where we are. Almost every aspect of our life has changed in every corner of the world. Almost 100,000 people have died and billions are living under lockdown. Today, Canada's Prime Minister Justin Trudeau told Canadians to brace themselves for a long road ahead.
Our healthcare systems across the country are coping for the time being, but we're at a fork in the road between the best and the worst possible outcomes. The initial peak, the top of the curve, may be in late spring with the end of the first wave in the summer. There will likely be smaller outbreaks for a number of months after that. This will be the new normal until a vaccine is developed.
The new normal. That projection is based on new disease modeling that was released today. These are projections, not certainties. In the worst case scenario, if Canada had done nothing, the federal model projects 300,000 people could have died. Putting in all the public health measures, physical distancing, shutting down non-essential businesses, asking people to stay home has slowed the spread. But a rise in deaths is still expected. Even with tight restrictions staying in place, it's projected between 11,000 to 22,000 people in Canada could die.
We cannot prevent every death, but we must prevent all the deaths that we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried and true public health measures.
The best possible outcome is what everyone, of course, wants, but the path to get there will not be easy. In our top story tonight, Mike Couteur takes us through the projections and how our behavior has a direct impact on what happens next.
On the anniversary of Vimy Ridge, Prime Minister Justin Trudeau continued to call on Canadians to do their part in the battle against COVID-19.
Over 100 years ago today, Canadians showed what metal we are made of. I know each of us will rise to be worthy of the legacy of the heroes that built this country.
An inspiring message on a day where Canadians face some sobering stats from public health officials. The most reliable forecasts only look at the short term, but even those numbers are grim.
Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
Canada's top doctor presented three scenarios, one with no epidemic controls, a second with some controls like physical distancing, and a third where strong controls were used. That's where Canada is now. Officials just aren't sure how far along the line we are.
You can't tell whether you've reached the peak until after the peak had actually been realized.
Officials also compared Canada to the rest of the world, showing we're right in the middle of the pack. The good news is that COVID-19 hit our shores later than others, allowing us to learn from other countries and not repeat their mistakes, like ordering physical distancing early and extending it for the foreseeable future.
On the downward trend on the other side of the curve, it will be equally critical to keep up with our control measures. If we let up, new chains of transmission will take off in our highly susceptible population, and the epidemic will reignite.
The government is mindful of that, while at the same time is trying to give businesses a little bit of hope.
We are extremely hopeful that we will be able to begin to restore a certain measure of economic activity in the coming months after this first wave is passed.
But even before that happens, the government has to pass the wage subsidy program to help keep Canadians employed. And late today, we learned the House of Commons will hold a special Saturday sitting to do just that. Donna?
Michael Couture in Ottawa, thank you. We knew closing all non-essential businesses would hit hard. Today, new numbers are showing how hard. At least 1 million people in Canada lost their jobs in March, an unprecedented number, pushing the unemployment rate to 7.8%. The service industry has been hardest hit, and as Eric Sorensen explains, the impact affects every corner of the country.
The restaurants are empty, small businesses shut down, hotels without guests, shopping centers cleared out, and on and on. More than any other sector, the service industry has been decimated by the pandemic. Of the 1 million jobs lost, 963,000 were in the service industries: retail, wholesale, full-time, part-time. The unemployment rate for the country jumped 2.2%, the largest one-month increase on record.
This is a huge economic shock, and it is going to cause a contraction in the economy, and then we're going to see the employment effects of that as well.
Unprecedented job loss, but jobs not lost forever.
We're asking people to basically shut down temporarily. So this isn't necessarily permanent jobs lost, it's temporary jobs being displaced thanks to COVID-19.
To put a loss of 1 million jobs in perspective, the previous high was 125,000 jobs in the historic recession of 2009. The difference in magnitude is stunning. The unemployment jolt was felt across the country. Almost 50,000 jobs were lost in Atlantic Canada, more than 260,000 in Quebec, over 400,000 in Ontario, another 160,000 across the 3 prairie provinces, most of them in Alberta, and then 130,000 plus in BC. No region was spared. In the hard-hit service sector across the country, some groups are disproportionately affected. Women, young workers, vulnerable workers in low-paying jobs. And the numbers only reflect the beginning of the pandemic. A month from now, 1 million job losses could be 2 million. And yet, it would be worse, but for the stimulus from Ottawa and other governments, emergency benefits going to millions of Canadians.
They actually can't stop the economic contraction, but they can certainly temper how bad it is, and they can also help stage the recovery that we expect later in the year.
Federal dollars prompted WestJet, like Air Canada, to put thousands back on the payroll. And Ontario, one of the first to strike a new Jobs and Recovery Committee, injecting some economic optimism.
We will come back stronger and more united than ever before.
Not just looking for light, but trying to create light at the end of the tunnel. Eric Sorensen, Global News, Toronto.
In the U.S., a decade of job growth has vanished in less than a month. 6.6 million Americans filed applications for unemployment benefits last week. That brings the total who lost their jobs in 1 month to more than 17 million. It's predicted that could rise to more than 20 million by the end of April. 13% of Americans are now out of work, the most since the Great Depression. Today, the U.S. Federal Reserve announced another $2.3 trillion in loans. That includes support for states, cities, and municipalities. Well, the already struggling oil and gas industry in this country is trying to plan for a long, slow climb out of disaster. Alberta's premier warns they'll soon be paying for companies to take Alberta oil. That wasn't helped when last month OPEC ramped up production, causing oil prices to crash to record lows. Today, oil producers held a video conference to discuss a production cut. Heather Yourex-West explains.
As members of the world's largest oil cartel met via video conference Thursday, Canadian oil producers could only wait with bated breath.
In the oil and gas industry, we've been particularly hit hard because we've had a complete crippling of commodity prices.
With oil prices hitting record lows, more than $8 billion worth of investment into Alberta's energy sector has been scrapped. Job losses have followed.
The reality is that no one is buying oil and the world is running out of places to put it.
It's why a production cut now by OPEC and its allies is so critical. Alberta's premier warns that at current rates, every square inch of storage in North America will be full within 4 to 6 weeks.
I don't need to tell you how catastrophic that would be for our industry should that occur. That's the kind of negative price scenario that I floated with Albertans on Tuesday night.
But analysts warn even an historic production cut of 10 million barrels per day or more will not be enough to get Alberta's energy sector out of this crisis.
While it is essential that we do have production cuts to help stabilize the market, this is more likely to guarantee a price floor and help buy time for all oil producers, including Alberta.
It's why the industry continues to press the federal government for help. Ottawa announced plans for a $15 billion bailout last month. 2 weeks ago, the federal finance minister said details were hours away, but since then, nothing. Mark Schultz says livelihoods are at stake.
We will see casualties, no question, and I think it will. The number will be determined by how much federal support we get, and that really is where we're at today.
Heather, Yourex-West, Global News, Calgary.
We know this virus is especially dangerous for older people, and in Canada, the biggest outbreaks have been in long-term care homes. In Ontario alone, there are outbreaks in at least 69 homes, and at least 88 residents have died. One place we're watching closely is Almont Country Haven, west of Ottawa. 10 residents there have died since March 29th because of complications from COVID-19. A statement from the home says in addition to those deaths, 20 other residents have tested positive. Families say they were kept in the dark for more than a week about what was happening.
I know they've done everything they can to try to stop it, but it's a small residence. There are many rooms that are multiple residents living in rooms, so shared rooms. So it's a very difficult thing to contain.
Those who run the home say they've put new precautions in place, including isolating residents in their rooms and ensuring staff wear full protective equipment at all times. Ontario's premier has demanded more testing be done in that province, and today the scope of who is eligible for a test was expanded. The province's chief medical health officer says vulnerable people, including caregivers and residents in long-term care homes and frontline healthcare workers, will get tested. That includes those who develop symptoms, even atypical ones, anyone newly admitted to a long-term care home, as well as residents who have been in contact with a confirmed case. And people living in remote Indigenous communities should be tested if they display symptoms. In 2006, after the SARS outbreak, Canadian health officials created the Canadian Pandemic Influenza Plan. It called for governments to stockpile everything from ventilators to N95 masks, gowns, gloves, and face shields, supplies that are now in short supply. One of the authors of that report was Dr. Theresa Tam, who is now the country's chief public health officer. Today, she was asked if Canada underestimated the severity of this virus and the need for medical supplies.
We're in a global global supply shortage situation for almost everything that we need. So I can certainly attest to the fact that everybody is pulling out all stops. And that is part of our role, is not to just stockpile stuff in a lot of places, but pull together the mechanism so that there's access.
From the UK tonight, a bit of positive news to report. Coming up, an update on the health of Britain's Prime Minister. We're keeping an eye on the rest of the world tonight. Let's look at the global numbers now. There are close to 1.6 million people known to have COVID-19. More than 95,000 people have died. The UK recorded 881 deaths today. New research shows that country could be the hardest hit in Europe. Scientists with the Institute for Health Metrics and Evaluation say Britain could have more than 65,000 deaths by August. There is a bit of good news out of the UK. Prime Minister Boris Johnson is now out of intensive care. The 55-year-old has COVID-19. He's still in the hospital under close observation. He was admitted on Sunday. In the U.S., there hasn't been a spike in hospitalizations in New York State today, but there has been a record-breaking increase in deaths for a third consecutive day. And now contract laborers have been hired to bury the dead on Hart Island in Potter's Field. That's where New Yorkers with no known next of kin have been laid to rest since the 19th century. 24 bodies are being buried every day, 5 days a week. Experts hand in their homework ahead, answers to kids' COVID-19 questions. We know COVID-19 has caused uncertainty around the world. Of course, what's happening right now can be hard for us adults to understand. It's even tougher for children. So tonight we're trying to alleviate some of their concerns. Jeff Semple is taking questions from kids right across the country to the experts.
Brianna and Bryson Rose have been stuck at home for weeks doing crafts to keep busy. And they, like a lot of kids, have a lot of questions.
Why can't I go to the candy store? Yeah, and why can't we go to our friend's house.
Kids' immune systems are usually pretty great at fighting the virus, but their parents and grandparents are at a greater risk.
So we need you at home to stay home for now and keep away from your friends and relatives until the outbreak has gotten under control.
Many kids also want to know more about the virus.
How did COVID-19 start?
Health experts think the virus started in a bat in China.
How did the bat from China even get COVID-19 anyways?
Bats can carry a lot of different viruses without getting sick.
The more close that we get to animals and the more that we disturb their habitat and go where they are, the easier it is for us to get viruses that we didn't know about before.
If somebody with the coronavirus touches some clay and then somebody healthy touches that clay, will they get coronavirus? That's my question. Bye.
COVID-19 spreads through coughing and sneezing. It can survive on something like a plastic toy for up to 3 days.
The virus doesn't jump. So it doesn't go from a toy into your nose. The only way it can get there is if you touch it and then touch your mouth and nose. And that's why washing your hands and not touching your mouth and nose is so important.
Is there any way to find out if I've already been infected with COVID-19 and recovered and not even known it?
Doctors in Toronto have actually just developed a blood test to determine if you've had the virus.
Those people are not likely to get infected again.
And for everyone else, Brianna and Bryson have a message.
What does that say?
Stay safe.
Jeff Semple, Global News, Toronto.
Psychology in a pandemic. Next, we check in on Canadians' mental health. Mental health is a big issue for so many people right now. There's so much fear and uncertainty and anxiety. We don't know when things will return to normal. Today, Canada's health minister had some reassuring words for Canadians.
This is a time for us to pull together as Canadians. We can all call those people that we know are struggling, or maybe even those that we're not thinking are struggling, to say that we're thinking of them.
Always good to reach out as we're all apart but together. Mike Drolet looks at the research tracking Canada's state of mind.
With spring in the air, life is getting ready to blossom in Toronto's Hyde Park. Every year, thousands gather to take in the sights and smells of the flowering trees. But in our new COVID-19 world, anybody who shows up will be met with the yellow jackets of bylaw officers enforcing physical distancing. And that not only stinks, it's starting to stress us out.
I guess my anxiety is triggered when I feel out of control in a situation, or when I feel like I can't plan or organize my life. And that's exactly what's happening with the coronavirus. I have no idea what the long-term plan is, even what the short-term plan is.
It's that anxiety researchers at Wilfrid Laurier University are trying to measure during this pandemic. What they found after 1 week in isolation was that while 40% of participants were feeling anxious or nervous nearly every day, those who had been laid off were having a much harder time than people working from home. In fact, breaking down the numbers even more, 30% of laid-off workers report they're feeling depressed nearly every day.
Some people are reporting that they find it hard at the psychological or almost existential level to make sense of what's happening. They feel conflicted, they don't understand what's happening in their life.
Motivating ourselves to get active is proving to be difficult as well, with 67% happy to do activities most days. Other research suggests to get out of our doldrums, we should be taking cues from the women in our lives.
Morale is higher, which is interesting, higher in women than in men. Now, we would have thought the opposite because women are more likely to be single parents and things like that. But we are seeing, perhaps because women tend to have better social networks or what have you.
With so much uncertainty in the future, connecting with others will be important in the weeks and months to come. Mike Drolet, Global News, Toronto.
And that is Global National for this Thursday. I'm Donna Friesen. As we keep you informed about this pandemic, I'll be hosting a special program on Global on Sunday evenings. Join me for Coronavirus, the New Reality. It starts this Sunday at 7 p.m. And we leave you now with an inspiring challenge for Canadians.
Oh, Canada.
Our home
That's just the warm-up. Every Sunday at noon, we're starting a nationwide sing-along dedicated to our frontline workers. You can share your version of O Canada using the hashtag #CanadaTogether. Thanks for watching. Take care of yourselves. Bye-bye.
North, strong and free. Mon histoire est une épopée. Des plus brillants exploits.